This is phase 1, stage 3, treatments and interventions. As always, there are challenges associated with each phase, and you can find which stage each one of those challenges are in by looking at the community group. All of the challenges are scheduled, or in the guidebook, or you can also print the PDF that spells out each one of the challenges as a checklist so that you have a sense of completion. I like checking things off, so I provided that for you. On the BOP portal, we have intervention guides. So you'll see when you log into the portal, if you took your orientation, you know all about this, but just as a reminder, we have intervention and treatment guides based on category. So upper body, self-care and community reintegration, balance and stability, lower body, cognition and dual tasking, therapeutic activities, and yoga. Please make sure that you are actually clicking into those platforms, into the individual pages, so that you can read the text that's in there. That doesn't always come up in the search feature. You can read billing, um, common interventions, some of the latest researched interventions. All of that is there and it's constantly evolving. So do double check those resources if you haven't gotten a chance already. So, treatment planning. What is treatment planning? It's a shift in your mindset to embrace a continuum based approach instead of a one off intervention approach. It happens to everybody. We all have a tendency to fall into this one-off treatment. The person arrives and we do these activities and we're not thinking about the next step, right? We just kind of forget and it becomes a session to session experience versus a big picture progressive experience. And we want to make sure that we're always progressing towards the completion of a goal, even if it's maintenance. If it's a maintenance oriented goal or an education and training oriented goal or a role psychosocial oriented goal, whatever it might be, we're constantly making progression. So we're grading up the activity to eventually uh, realize the fruition of that particular goal that you've set with your client. So when we're talking about treatment planning, what is an occupational therapy treatment plan? What should it include? And the big idea is to shift your mindset to embrace patient-centered and science-based treatment plans. So we're mixing the two. We talked a little bit about this in another video where we're combining an occupational profile and a clinical profile, making sure that we have a holistic perspective. The same thing is true in a treatment plan. Yes, we want this experience to be client centered and patient centered, and we want the client to kind of be in the driver's seat. But you also have to remember that they're coming to you because they can't do it on their own. They're expecting you to know your stuff, right? You have to know your rationale, you have to know your why, and this why is driven by medicine and science. It's true that we are not wholly reductionistic, right? We're not biomedical. We see the whole person. We understand that it's not just about the diagnosis and the impairment driven by the diagnosis, but it's also about participation restrictions and activity limitations due to contextual factors, environmental factors, social factors, different contexts, right? All of these things drive patient care. All of these things are important. But notice how I didn't exclude the biomedical reductionistic mentality. Like we still are including the medical portion of it. The diagnosis and pathology and mechanism of action still matters. And that's why we use a science-based approach as well. And that's what you bring to the table. You bring this ability to understand these medical concepts. You bring that to the relationship. And so we have to remember that there is still a patient therapist dyad just as much as it is a patient driven plan of care. Okay. So do keep that in mind that when you're treatment planning, you want to have a balance between client driven and science based. or therapist-driven treatment plans. So when you embrace the continuum-based mindset, you become a beacon of excellence in occupational therapy because you're embracing the full scope of our profession. You're truly embodying this biopsychosocial lens, and you're bringing everything to the forefront, anything that is valuable to the client, anything that your client deems important and deems significant in their well-being, whether it's an asset and it's a support to their occupational performance, or it's a barrier to their occupational performance. We will know that when we keep a holistic perspective and when we have a continuum-based mindset, we can always be driving towards these goals that the client finds meaningful. This continuum-based approach redefines exceptional care and makes a lasting impact on patients' lives, because you're essentially going from this bottom up to we're working in bottom up and top down territory. So we're working along a continuum. Maybe in the beginning, we're working more in the biomedical model where we're addressing body functions and structures, but we're maintaining our top down lens because we're working towards a more functional activity. Okay. The treatment portal offers resources for comprehensive and evidence-based care. So when you're looking at our interventions and the different approaches we've used, or you're looking at our SMART goals or our evaluation goal continuums that we use at BOT, when you're looking at that, start allowing that to drive your process. Not that you're copying what we do, because you don't need to do that. You may not agree with everything that we do. You may not agree with everything that you read or hear or see, but it's a way for you to evolve. Knowledge is constantly evolving, and there's room for that. So when you're looking at these treatments, consider how they work in a continuum within your context with your clients. Okay, I want to draw your attention to the challenge for this stage. An interventions challenge. Post a photo of an item you use or were taught to use within your treatments or interventions. Describe why you would use this proper item. What diagnosis or limitations would help, or would it help? Describe any thoughts that would benefit the group. Have an item in mind that if you have an item in mind that you don't recommend, or that is commonly used inappropriately during an intervention, post that as well, or post that instead. Anything that you can post and contribute to the community, whether you agree with it and you explain why you agree with it, or you don't agree with it and you explain why you don't agree with it, start a conversation. And when those conversations happen, that's how knowledge progresses. That's how we diffuse knowledge into our communities, is by having these conversations. So take time to pause here, stop here at this module, go complete your challenge, and then return to continue.